Hello and welcome into the clinical chemistry. In this lecture, I will talking about the malabsorption syndrome. This lecture is presented by Dr. Zuhair. Here, what is the malabsorption syndrome? By definition, it is a state arising from abnormality in absorption of food nutrients across the gastrointestinal tract by meaning GIT. Impairment can be of a single or multiple nutrients depending on the abnormality. This may lead to malnutrition and variety of anemias. Malabsorption constitutes the pathological interference with normal physiologic sequence of the body, such as digestion, intraluminal process, absorption, mucosal process, and transport is post-mucosal process of nutrition. Causes of malnutrition or malabsorption. Intestinal malabsorption can be due to digestive failure caused by enzyme deficiencies, structural defects, mucosal abnormality, infective agents, systemic disease affecting GIT, uh, due to digestive failure such as pancreatic insufficiency, which the pancreatic can here defect of or causes due to other disorder in pancreas, which include cystic fibrosis, chronic pancreatitis, carcinoma of pancreas, bile salt insufficiencies, which include obstructive jaundice, bacterial overgrowth. Two, due to structural defect or malabsorption due to structural defects, and this is found in many type of disease, such as inflammatory bowel disease, commonly in Crohn's disease. There is a gastro and gastroduodenum, fasciculate disease and structures, infiltrative conditions such as amyloidosis, lymphoma, short bowel syndrome, eosinophilic gastropathy. This also due to many diversion. 3. The malabsorption can be caused due to mucosal abnormality, and this can be found in celiac disease. Malabsorption in number 4 can be caused due to enzyme deficiencies, this such as lactase deficiency, which include lactose tolerance, disaccharidase deficiency, and enteropeptidase deficiency. Malabsorption can be caused due to infective agents or parasitic agents. This can be found in Weevil disease, intestinal tuberculosis, tropical sprue, parasites such as Giardia lambella. The malabsorption also can be caused due to other systemic disease affecting GIT tract. Type of this systemic disease which can be such as hypothyroidism and hyperthyroidism, diabetes mellitus, hyperparathyroidism and hypoparathyroidism, carcinoid syndrome, malnutrition. All these are the causes of malabsorption. So, what is the symptoms of malabsorption? Symptoms can be included extra-intestinal or intra-intestinal signs and symptoms, which these include diarrhea, often steatorrhea. Steatorrhea here by meaning increase of fatty acids or lipids in stool is the most common feature of it is due to impaired water, carbohydrate, electrolyte absorption. Other symptoms include weight loss, growth retardation, swelling or edema, anemias, muscle cramps, and bleeding tendencies. All these are the symptoms of malabsorption. So, what is the specific disease entities causing malabsorption? There is some of a specific disease that can lead or to cause malabsorption, such as one celiac sprue. This is the most of the common cause of malabsorption. including ranging from the first year of life through the eighth decade. The etiology of the celiac disease not known, but three factors can be contributed, such as environmental factor, immunologic, and genetic factor. There is environmental factors maybe include there is association with disease with gliadin and a component of gliadin that is present in wet. Immunologic factor serum antibodies are detected such as anti-gliadin. The genetic factors most all patients express the HLA-DQ2 allele. How can to diagnose this celiac spore disease or celiac disease? Diagnosis is made all by a small intestine biopsy can be done for suspected patient. The hallmark of celiac spore is present in abnormal small intestine biopsy. Tropic sprue can cause infection agents including Giardia lambella, Yersinia, Enterocarditis, Clostridium difficile. All these bacteria and protozoas can lead to tropical sprue. It is tend to involve in a distal small bowel. Total villus atrophy is uncommon. Three Crohn's disease. It is an inflammatory bowel disease marked by a patchy area of inflammation anywhere in GIT from mouth to anus. Body immune system attack GIT, leading to chronic inflammation. Short bowel syndrome, following restriction, diarrhea, and steatorrhea can appear due to decrease in the area of absorptive surface area. Hereby meaning the bowel syndrome, there is also a decrease in the surface area that absorbed the food or nutrition in small intestine. Other symptoms include cramming, bloating, and heartburn. Number five, bacteria overgrowth syndrome, one of the special type that can lead to malabsorption. There is a proliferation of colonic type of bacteria with the small intestine due to status caused by impaired peristalsis. Peristalsis here by meaning the movement of small intestine or the dynamic movement of small intestine known as the peristalsis movement. This leads to diarrhea and malabsorption. Also, the pathology of this bacteria overgrowth can lead to metabolized bile salt, resulting in deconjugation of bile salts, low or bile salts, and malabsorption of fats. Damage of intestinal villi by bacteria invasion, toxin, metabolic product. This can lead to damage of villi that can cause total villus atrophy. Weebles disease caused by bacteria Troponema weebeli affect chronic multisystem disease associated diarrhea, steatorrhea, weight loss, anorexia, and central nervous system and cardiac problems. Diagnose identification of Troponema weebeli by polymerase chain reaction by meaning PCR or by a special stain known as the periodic acid shift, which can cause or give positive with macrophage in small intestine that contains this type of bacteria. Other organ with evidence of disease. Management of malabsorption syndrome, how to manage these disorders due to malabsorption. Also can be done by replacement of nutrition, electrolyte, and fluid to be necessary. In severe deficiency or hospitalized admission may be required for parenteral administrations. pancreatic enzyme are supplemented orally in a pancreatic insufficiency. Dietary modification is important in some conditions, such as gliadin-free diet in celiac disease, lactose-free diet, or lactose avoidance in lactose tolerance. Antibiotic therapy, and this for the treat small bowel bacteria overgrowth. Thank you very much, and I will see you again. Thank you.